I keep looking at my phone. That's because Alexandria Ocasio-Cortez is supposed to call me around 3. I want to make sure that I say hello.
Yes.
But ultimately, I mean, what happened yesterday is a symptom of what's happening around this country, the kind of intimidation and bullying that is taking place, the slow move towards authoritarianism that we are overlooking, that people are clearly overlooking because it's not as stark as people would expect it to be, right? Or you think that it goes on in another country and it's not happening here. But it's slowly happening. Disregard for Supreme Court orders, the trampling over local laws and the Constitution of the United States, kind of undermining congressional authority. All of this stuff is really a real move towards authoritarianism. The intimidation that they tried to put forth yesterday, a very dangerous time that we're living in, and it calls upon people with courage and clarity right now more than anything to explain to everybody what's going on and what they're seeing, and have the courage to do that in fear of being arrested. These people have arrested judges. So, I mean, if they arrest a judge, they arrest the mayor of the city of Newark, they can arrest anybody. And they get on TV and lie, even though there's videos that show you what actually happened. I mean, in front of a video that you can see what happened. And I mean, these people are so used to telling us anything, and the press is, I mean, we won't question them. I've sat there, I was on CNN this morning listening to them tell an entirely different story. I was like, well, maybe they were somewhere else. Maybe they're talking about something else. I mean, this is like ridiculous. It's like 15,000 videos, and these people are still making these things up. But ultimately, the Congress people came down there because they have the right to have oversight, and was told to come down there at that time. Right? They asked me to come and be a part of a press conference, and I went down there, and the press conference turned into that thing. It's really bizarre because I was out there for over an hour, with ICE agents and everybody before somebody made a decision to just arrest me. Right? We're going to get him, and that's it. They targeted me and arrested me, manhandled the Congresswoman. They said on TV that one of them body slammed an ICE agent. I said, I'm sure. I know you're talking about Congresswoman. This lady's 80 years old. She's body slammed who? I'm like, you people can't be serious. Like, it's so ridiculous. But my God is good. We're out of there. They try to keep me in there for the weekend, but like I said, there was a lot of people working on our behalf. So God is good, and I'm thankful to be out here today to continue doing what we're doing, and not have to spend there till Monday morning to what they try to do.
So I'm just going to yell so the mayor can keep the microphone. So the mayor has put out a lot of policies and his positions on what he would do as governor, which is something we looked at, and if you haven't already looked at, I encourage you to go to rasforgovernor.com and really dive in. But today, I wanted to ask the mayor, he has a vision for reimagining New Jersey. And when it comes to healthcare in particular, we wanted to talk a little bit about that today because of what's going on in the country nationally. We're on the eve of Mother's Day, and there's a lot of issues around healthcare that still need to be addressed, and the mayor has some good policy that he has put forth to address that. So my question to you, Mayor Baraka, is when you think of being governor of the state of New Jersey around the issue of healthcare, how do you reimagine healthcare for the state of New Jersey?
Thank you. I know everybody in this room and many people I meet around the state, healthcare is probably on the top 3 most expensive things that they have to deal with. It's one of the reasons that's driving costs. And it also drives your taxes up because the state, the county, and the city governments where you live all have to pay healthcare for their employees. And the healthcare costs they go up arbitrarily because the deals are made between insurance companies and hospitals without any oversight, without any transparency whatsoever. And, you can get the same procedure at 3 different hospitals, and the costs are wildly different, because, honestly, these people have made these decisions, and they decide to go a certain percentage above what Medicare is, right? So Medicare sets the costs across the country. Hospitals and insurance companies decide how much above that they want, based on their overhead or administrative costs, or all these other kinds of things, or just arbitrary profit costs. In New Jersey, what we're saying is we should institute what's called reference-based pricing. Reference-based pricing forces or tells these companies, we're only going to pay this amount of money. We're not going above this amount above Medicare. We can negotiate what we think your administrative costs may be, and we'll go above that Medicare. We're not going any further. If we just went 150% above Medicare in New Jersey, we would save the state over $1 billion in 2 years, right? And so that's real money that you can use to put back in the budget or put back in healthcare, put back in Medicaid and expand Medicaid in different ways, to extend more healthcare to more residents, to more employees. But more importantly, what we can begin trying to figure out to do is begin to create an opportunity where we have a public option, where people in New Jersey can decide to be under a public health care program, just like a state employee, right? With no, and we extend to a point where there's no co-pays and no like out-of-pocket costs for folks who decide to be on this thing, right? So we believe now is the time to do it, especially since the federal government is threatening to take money away from Medicaid. So the best thing that we have to begin doing is figuring out how do we create a healthcare system internally in New Jersey that's devoid and absent of the federal government that can function without them. And New Jersey has the ability to do that. One of very few states that does have the ability to do this. We're our own administrator, and the state is wealthy enough in order to make this happen.
I'm sorry if I interrupt to clap because I've spent years in healthcare, and it's music to my ears what you're saying.
Are there other states doing just that currently, or?
Yeah, there's states that do use reference-based pricing now throughout the country. Not a lot, but some. And the reason is because the lobbyists are strong, right? The insurance lobbyists are strong, the hospital lobbyists are strong. And, in fact, a lot of our elected officials are either they get money from these lobbyists or they're actually a part of these organizations, these firms that are the lobbyists, right? So they get a lot of money from these organizations, and the insurance companies sponsor almost everything we have, from the League of Municipalities to all these other events, the organization of county administrators. So they sponsor these events, which makes it difficult for people to push these things that they want to push for residents of the state of New Jersey, right? And we just have to. People are complaining about the cost of living in New Jersey and how high it is. Everybody knows what needs to be done, honestly. So it's not rocket science. It's just the will to do it and having the courage in a time like this to actually get it done, right? Because the conventional wisdom would be in scarcity, in times of scarcity or times of fear, crisis, they think we do less. We should do less, like hold on to things. The opposite of that is actually true. If you look at the Great Depression or any other time in this country, any time we got out of this, we began to invest in families, in people, right? Put money in their pockets, give them more opportunity, give them more access, create more jobs, because then people put that money in the economy. Because wealthy folks put money in IRAs and tax shelters and other things like that. Working people spend their money, not because they don't have financial literacy, but because they have bills, right? And we pay those bills. That actually helps fuel the economy, especially the economy that 70% of the GDP is about exchanging goods and services. We are a economy where we buy things. Like folks, they have this argument about iPhones. Well, Americans don't want to make iPhones; they just want to buy them, right? And this is the economy that we have in this country. And so the reality is we have to put money in people's pockets, right? So they can put money back into the economy.
Could you elaborate like how you envision a public option? Because that was actually the issue that really caught my eye. I read every single candidate's policy platform, and as a self-employed person that uses the ACA and has since day one, that really intrigued me about how my understanding is that it cuts out insurance benefits. And and you're literally buying into
Yes.
like a state, like you're buying into Medicare basically.
That's exactly what you're doing.
Okay.
That's exactly right. And so what happens is the state we're already an administrator of ourselves. We already administrate Medicare, Medicaid. We do that in New Jersey already. What happens is you have private stuff going on. The reason I say public option because everybody is not going to want to be a part of it. You want folks to have the option to say I want to be a part of this public insurance program, and everybody else to be on the private side. And I believe honestly that if you do that, more and more people are going to leave the private insurance companies and come into the public sphere, which is what's happening around the world, by the way. I mean, we're the only the developed nation that does not kind of administer healthcare at this level, right? You got places like Canada and France, right? The irony was in the Olympics when our folks played over there, Americans, when they got sick or they got hurt, they actually participated in the healthcare system and they didn't have to pay anything. That was the first time were used to being in the healthcare system where they didn't have to pay anything. They have to come back here and you pay an enormous amount of money. State employees or public employees in New Jersey pay into their healthcare system. Christie started that, Chapter 78, which means that even if I negotiate a contract with you, a large portion of the money that you get from the contract is going to be paid into your healthcare benefits, right? And as those costs go up, you get less money to take home. So you get hit twice as an employee of the state or municipal employee. You get hit by your employer, and you get hit because God forbid you're a homeowner. Your taxes are going to go up because the healthcare go up. So you're paying twice in essence. Like people don't look at it that way, but you are. Like God forbid somebody in your family gets sick. Not only are you paying healthcare, you're paying the insurance, you're paying the copay, right? And then you have to pay the out-of-pocket costs, that the insurance company doesn't cover, right?
And how do you propose to change that?
Well, the reality is we have to start pulling money back into our healthcare system in New Jersey. So that's why I always begin with reference-based pricing, that we have to first say, we're not going to pay this amount of money. This is ridiculous. Governor Murphy created the Office of Healthcare Accountability and Transparency, but it has no teeth, right? What they can do is meet about stuff, and we're good at that in New Jersey. We meet about meetings, and discuss the discussions, and so they can make advice. They can give advice, but they should have teeth. Like they're talking to hospitals, and the first step is them getting in the middle of the negotiation between the hospital and the insurance company and saying, look, you guys are negotiating this price way up here, but we're going to pay right here. This is all we're paying. We begin saving money. I think that helps us move into that, because I don't know if the legislatures and everybody else have enough courage to jump right into a public option. I think reference-based pricing gets people to see we're saving money. Then we have to be honest and start having these discussions very quickly about what a public option looks like. And I think Trump is going to drive us into that, because he's going to start cutting money and doing all kinds of other things. He's going to drive us into this discussion quicker than we imagine to do that. And we also have to bring back these Christie tax cuts, bring back the billions of dollars, $15 billion or more dollars that we were giving away since Christie was the governor to the super wealthy in the state through tax breaks and tax cuts. Bring that back to our budget and use parts of that money to help us fund what our public option would look like.
Well, I have being though tomorrow is Mother's Day. One of our colleagues was going to come today, but she had to be with her mother, so she was excused. But we wanted to ask, Mayor, you've been mayor for 10 years now in a city that has the state's only public hospital. You have dealt with COVID. You have done a lot in terms of public health across Newark. And I wanted to ask, on the eve of Mother's Day, one of the crises that continues here in New Jersey is the Black maternal health crisis and the infant mortality crisis. We have not closed the gaps, and we still have Black women who are 3 times at greater risk of mortality and dying due to childbirth. What are some of the things and some of the lessons learned from your time in Newark that help shape your vision, and what is it you would like to see happen in the state of New Jersey if you are governor to address some of those long-standing disparities?
Yeah, so African American children are 3 times more likely to die before one in hospitals. African American women 7 times more likely to die giving birth. And the other part of that data point is it doesn't matter their socioeconomic status, which is the most important part to me, because what it says is that the system is uneven. There's no universal design, and that's what we should be working to make democracy to have a universal design, meaning there's access points for everyone, right? And because there's no access points, in this sense, because of cultural incompetence, and because of doctors who are insensitive and unaware of people's specific problems, or their complaints about pain threshold, and all this other kind of stuff. They think African American women can take more pain than everybody else, that you're not actually experiencing anything, that you just are complaining, which leads to death in hospitals. So it's not even about the type of healthcare, or it's not about the insurance company, right? People always say, oh, it's the insurance company. It's not, right? The reality is, statewide, we need a committee of women, predominantly black and brown women, who are making policy around maternal care in New Jersey, about people's relationship to the hospital. We need to make sure that Medicaid and Medicare, as we just talked about, is expanded so that it includes doulas and midwives, so people can bring them with them into the hospital to direct doctors' hands and set policy for the hospital. The same way the police, the law enforcement join with public health to make sure that you can't leave the hospital unless you have a car seat in the car. When the child is born. That kind of policy needs to be created by this committee statewide around how you're dealing with women of color in these hospitals, and access and the access they give to other people to help them along a difficult journey where people are actually dying, right? And the children, I think, are similar, but there's some other issues there, and that does have to do with access to primary care physicians, and have access to guiding women through everything that they need, through vitamins, through checkups, through support, all the way through the pregnancy as well. But doulas and midwives can help with that as well. But also, I think the other piece is creating clinics across our community with primary care physicians, directly in housing buildings, directly as a part of commercial development, so that we could put doctors in neighborhoods where doctors don't exist, right? In Newark, we use a mobile van that we go around and we set the mobile van up in neighborhoods, and they stay there for weeks, and then they go to another community, go to another community, go to another community, to take the place of the fact that there are no primary care physicians in this place. We also built we work with the hospitals and the private sector to build a clinic under a housing complex in the city of Newark, in the city's West Ward and in the city's East Ward. We built not just a housing with a clinic, we built a housing with a clinic, and in the clinic is a food pantry. These are the kind of things that we have to be creative about doing, especially when we're talking about this housing crisis across the state and the kind of housing we want to build. We have to be creative about the kind of housing we build in neighborhoods, right? People have one idea about what housing looks like. We have to be very creative. This is a time more than ever that calls for creativity, calls for imagination. I mean, it's the time now, in the middle of a crisis, we have to be as imaginative as possible now.
Mayor, you just touched on housing a little bit and some other things. You have a very broad vision of health that includes really addressing the social determinants of health. Can you talk a little bit more about your vision for that?
Absolutely. I think so. If you take, and I've been saying this all over the state, if you take a city like, if you take the South Ward of Newark and compare it to Livingston, which is 8 miles apart, you can ride your bike there. There's a 14-year life expectancy difference between those two communities. And those are centered around the social determinants of health. access to food, quality food, access to good housing, access to healthcare. You know, all of those things affect your ability to stay on the planet longer, obviously. So the work that you do in these communities actually add years to people's lives. So healthcare, even violence. Violence is a part of healthcare. Like trauma is a part of, or addressing trauma is a part of health. And not being able to address trauma properly is what allows violence to extend and grow unchecked, because we're not addressing trauma, and trauma is a part of these social determinants that I'm talking about in these communities. So people have to have access to quality food. They have to have access to housing, and decent and affordable housing that's not stressing them when they're spending 30 to 50% of their income on housing, right? And they don't have money to purchase food at a quality, because you know good food costs a lot more money, right? Purchase quality food, or at the same time send their kids to the doctor, especially if you're using the emergency room as your primary care physician. Because that means that every time somebody gets sick and the medicine is not taking care of it, you go to the emergency room because you don't have a doctor. And when you go to the emergency room, costs are the highest cost in the hospital. So, I mean, it drives up the cost for the hospital, also drives up the cost for you. And so I think that taking care of all these things in the community is how we address health, people's individual health, and the overall health of people's neighborhoods.
Mayor, could you talk a little bit more about the things you would do to raise sufficient revenue to fund many of these social and economic programs?
I'm glad people say that, because that's the first thing you go, oh, this is, how are you going to do that? It's too expensive. You know what people, you know what's not too expensive? Giving people these tax breaks. You know, they never say that's too expensive. We don't have the money to give people these breaks, but we do it. We give it to them over and over and over again, and the idea is we don't give them these breaks so they can stay in the state. If they stay in the state, they're going to create jobs. They're going to put the money's going to come down to you. But you ain't never got no money from none of these people. It don't never trickle down. It didn't trickle down when Reagan thought of it. It ain't trickling down now, right? The reality is that it does not exist. And what I learned during COVID, that all of that was really a lie. COVID taught me more than anything that they found money for everything they wanted to find money for. The money was growing on trees, right? They gave you a stimulus check. They gave cities ARPA dollars. They found ways to stand up hotels. We found ways to put people in shelters. We found ways to bail businesses out. We did all this stuff. We put all this money in the street and all this money in people's pockets. And nobody complained. Nobody said anything, right? The problem is we did that and we still gave billionaires tax breaks. That's why we're in the situation we're in now. I'm a mayor of a city, so I know this is not the Oprah Winfrey show, so I can't give everybody a tax break. Right? I can't say I mean, it's ridiculous, right? Who's going to pay the bills? We don't sell cars out of back of City Hall. Our money comes from tax payables. So either you pay property taxes, commercial taxes, hotel taxes, you know, corporate taxes, industrial. Our money comes from your taxes. So I can't give middle-class New Jerseyans a tax break and the super wealthy a tax break at the same time. It's impossible. I can't pay bills. You know, if we fix the tax code in New Jersey, just turned it right side up, we could actually give a real tax break to every New Jerseyan that made $100,000 and less. A real tax break. So everybody else made $100,000 and less. If we made everybody pay their fair share, we can give New Jerseyans their money back. That's half the state makes that amount of money, right? We could give the entire half the state the money back. Or we could take that money and invest it in whatever we want to talk about. What are we talking about here? And that's not even repealing the Christie tax break, because that's just making the tax code fair. If we made it fair, we would have enough money to do most of the things we're talking about, or at least give you some money back. And now if we repealed the Christie tax cuts on top of that, and made the corporate business tax stay in place too, we could do a lot more. We could fund New Jersey Transit expansion. We could actually fund affordable housing. We don't have to raid the Affordable Housing Trust Fund. We don't have to raid the green space, the open space trust fund. All these trust funds we create to do specific things. We don't have to raid them anymore because we have money, right? The question is, why do they always raid the Affordable Housing Trust Fund? Why always raid the Transportation Trust Fund? Because we have these gaps. Why do we have these gaps? And then people say, oh, we're spending too much money. you're spending money, and some of it you can pull back, but the reality is, you've given $15 billion away. I mean, you can't do that. I mean, financially, it doesn't make sense. So the money to fund these things are there, and some of the money to fund it is in the actual program itself, like Medicare. Is actually there, and Medicaid is actually, the money is actually there. The money for transportation is actually there, and instead of spending it, what we're doing is widening highways for billions of dollars. We could be building trains, expanding bus routes, putting more money back in public transportation, right, and cleaning the environment while you're doing it at the same time. Giving people access to jobs, to opportunity at the same time. So the money is there, we're just spending it on things that don't involve you, right? So if I'm running for office, the first thing I put, I'm gonna give people tax cuts, right? Everybody get excited about that. But the most people that get excited are never gonna get the tax cuts. Because you think they're talking about you, but they ain't talking about you. Oh, tax breaks. Oh, yeah, I get a tax break. You never see it because they never was talking about you.
And if you do get that tax break, when the budget comes around, you're gonna find out what they're cutting.
Right.
That you rely upon. So, being in that budget season
That's
right
right.
now, in New Jersey, it's rough road here. We've got the Trump administration who is, doing all kinds of things. The example of what happened yesterday being one of the most egregious. But in terms of funding, are really threatening a lot of the funding we have. And you have spoken several times really eloquently about how housing is health and how part of your plan to address affordable housing actually not only solves a housing crisis, but can actually bring more revenue into communities and help us fund the services we need. Can you talk a little bit more about that?
Yeah, I mean, I think that housing is a crisis in New Jersey. I think it's a crisis in this region, in the wealthiest region in the nation. It's a crisis. We are 230,000 units short. The reality is we have to make housing development in New Jersey a public works project. That means we have to make a decision to build 20,000 units in the next 2 years. Right now, the state builds 3,000 to 5,000 units. You have to double, triple that number. You have to set it and create a fund to be able to do that. And I say the public bank is the way we begin to do that, right? And it's not a commercial bank in my mind, it's an investment bank. We put state dollars, pension dollars, or tax credits applied to this bank, get municipalities to do the same, and investors to put money in this bank. We take that money and begin to invest in housing led by the state, first around areas where transit exists, right? And create thousands of jobs in the process, putting people to work. We sit with the building trades, housing advocates, local mayors, and folks can sit down and map out how we get this done, how to identify the housing we build, where we build it at. I think we also involve community development, nonprofit housing developers to be engaged in this, because all of the housing is not going to be big units. Some of it may be 2 families, 3 families, maybe ADUs that you put on people's homes, or affordable home ownership on irregular lots as starter homes. You begin to do that around the state of New Jersey. You put a lot of people involved, make a lot of people involved, put a lot of money in it, on the table, and it begins to create a market for itself. And you invest in infusing dollars into the economy right away. And you're infusing it in areas, one, that need it the most, and then 2, in communities that haven't seen development in a long time. You begin to infuse that in those communities, and you put families in those neighborhoods. The thing that we get confused about, we think that more families in our community is going to drive our costs up. The reality is your costs will go up a little, but more families in your community helps lower your costs. Especially, it lowers your school costs because you put students in schools and the state begins to fund those students and not your pockets, right? And people think the reverse. That's because they don't understand how the thing works. The reality is you're paying more because you have less students and the prices are going up with the same infrastructure that you don't need, by the way. That's why around the state, people are threatening to close schools because the infrastructure is too much and they don't have the students that they used to have. They're paying more out of their pocket and the state is paying less. And so housing addresses a multitude of these problems if we begin to push it like it's a public works project. Same way we did lead service lines. That means we have to put it out there, the state has to run it, we have to partner with people around the state, and we have to physically say, by our actions and our dollars, investment, that we're gonna build 20,000 units, 2 or 3 years, we get it done.
So based on what you just said, are we talking rental housing, home ownership?
Both,
or
both. And I think that begins so a lot of things are attached to this. So once you start, we need to build affordable housing, that's number one. So once we start doing that, especially around transit, we begin having a discussion about how do we expand transit in areas where we need to build this housing at. That's 2. Third, you begin talking about workforce housing, because workforce housing is a part of that, which is people that about 120% of the AMI, area median income, is set by HUD. These are people who make too much money to be classified as affordable housing, but if you put them in the marketplace, they can't play in the marketplace because it's too expensive. That's just like workers who unions fight for them hard and get them a wage increase. Now they're really doing them a disservice because they got no wage increase. And now you're outside of a bracket, a tax bracket, and you have to pay for things that you can't afford. Because you get more than you have, but not enough.
Someone in the back there?
Hi, happy Saturday. Just to follow up on the housing. So I'm not a native New Jerseyan, I'm a New Yorker, and my thing is, my husband and I settled here because of the area, the farmland, away from concrete, Manhattan. So my thing is, when you talk about housing, you're talking about increasing, 20,000 units.
Yeah.
20,000 units is a lot, and you're talking in that level of increasing it. I love the plan, I'd like to see the strategy as far as in coalition with the housing, with the workforce, and again, I don't see the education there. Are these people gonna have menial jobs? What type of jobs are these people gonna hold? Outside of the ones that are actually going to be relatively looking for first-time home ownership, what's gonna be the stipend? Are we gonna build these units? Is this gonna be a continuation of, what
So we're not building the projects, so that's not what. So I know that's what people are afraid of, because I know that's what's in your mind, but that's not what happened.
Because when I chose to stay here in Jersey, I chose it because of the small community, less people, less concrete. I go home all day, any day I can drive back to New York. But the issue is, when you talk about building these units, they already had an issue in Mount Laurel where they had to sue and all this good stuff came about. But my question is, we're now in the South Jersey area, already faced with loss of farmland, loss of green acres, loss of everything. So for us particularly, not for northerners, for us particularly, when you talk about building these 20 units, to secure that land, is that gonna be farmland? Is it gonna be a land where you already have a warehouse?
There's enough land in New Jersey,
Yeah.
there's enough land in New Jersey, especially around places where there's transit, and that's where we should start first.
We don't
Before
have
you-
transit out here, man.
Well, there's areas where there's transit, and that's why I'm talking about we need to expand transit so there becomes transit down here for people. That's why when you get further south in New Jersey, the Alice report is worse. Asset limited, income constrained, but employed. That's why folks, the further south you go, the more poverty grows because of the lack of transit, right? Because of the lack of access to the market, lack of access to jobs, lack of access to healthcare, to everything, right? To the job you're talking about. And when we start talking about affordability, we always think we're talking about no income or very low income. Affordability is huge. It is established by HUD, so there are areas of affordability. You got 40%, 60%, 80%, 120% of the area median income. Some of these people have jobs. In our mind, we think that we start talking about affordable housing, which is really a creation of what has happened in this country to us, right? At the end of the day, affordability is your child who just came home from college, who can't afford to live in your neighborhood because they can't afford to buy a home there because it's too expensive. Affordability is your grandmother or grandparent who's on a fixed income, who cannot afford to be in her home and pay her bills at the same time as the taxes go up and the state keeps giving her the same check over and over and over again that's becoming smaller and smaller and smaller for her. That's affordability. Affordability is people who lost their job, that's transitioning from job to job, right? That's what affordability looks like. Or people that whose wages are too low, right? And so The problem is, in New Jersey, if Newark is building an affordable housing unit, so we build about a third of the affordable housing in New Jersey. The waiting list for an apartment is about 5,000 people, right? Because you're talking about all these people in the area who are looking for that apartment, right? Because the other apartments have been put on the market for luxury units, right? Because the market is geared towards luxury units. So, it's getting less, so homelessness in New Jersey last year rose 24%, right? And so you're talking about a serious crisis that the state has. That's why we have to build 230,000 units. People scare us, so you got Chiarelli and folks like that and say we should build this housing, but build it in 7 cities, which is mathematically impossible for us to build housing in 7 cities. Plus, the thing you're trying to prevent, it will create in those 7 cities, right? The reality is we need mixed income, mixed use housing across the state of New Jersey, right? And affordable housing does not just mean rental units. Affordable housing, we have to be creative about what we think when we say that. It should be accessory dwelling units, should be